CBS News medical contributor Dr. David Agus joins us now from Los Angeles for more on this. David, actually, let me start there with the students. We hear that new guidance. What about vaccinations for kids under 12? Are we expecting that anytime soon?
We certainly hope so. You know, the trial is ongoing now at a lower dose than adults got, and it looks excellent. It's protecting, we're getting very high levels of immunity, and it's remarkably safe. So my hope is that potentially by the end of the summer, it could be filed at the FDA and starting to vaccinate kids in September. Obviously, every parent wants that to happen as soon as possible if they're going to vaccinate their child.
David, it's wildly different in different states, the vaccination rates right now. Vermont, for example, is around 80%. Alabama is closer to 40%. With discrepancies like that, how does that impact places where masks are still required everywhere for everyone, like airports? What should we be doing?
Well, I mean, we have two countries, right? We have the vaccinated and the unvaccinated. Only half of our citizens in this country have 2 shots, and you need 2 shots to be protected from Delta. So because we're not requiring a vaccine passport, that is a validation that you have a vaccine, we're still, and we should, require masks at airports, at all public places, on planes, places you can get indoor and potentially spread this virus. This new Delta virus is dramatically more infectious than all the previous variants.
And with that in mind, Dr. Agus, the Delta variant being sort of like the big question mark for so many of us, should we be looking at a shot that specifically targets that variant?
So the original variant is what the original virus is what the vaccines were designed to, and it changed over time, and that's what the variants are. So our current immune responses clearly protect against the Delta. There's a trial that's beginning shortly with a Delta-specific variant, but right now it's not needed. And I don't think it will be needed, but we have to be on our toes. And it's basically a dress rehearsal in case a variant comes that doesn't respond at all to the vaccine. It's not been identified around the world yet, but it's a potential.
Doctor, how susceptible are people who have already had COVID to the Delta variant?
They are susceptible. That's the problem, is that when you get COVID, much of your immune response is not neutralizing, not to that spike protein. And with Delta, you need a really significant neutralizing antibody and T cells. And so you need to get the vaccine if you prior had COVID to be protected from the Delta variant. You really do.
Okay, Dr. David Agus, thank you very much.